In his first term, President Donald Trump vowed to eliminate HIV in the U.S. by 2030. Now his administration is eliminating research grants and federal health jobs focused on fighting the HIV epidemic in the U.S., part of its plan to boost government efficiency. And now advocates fear that decades of progress will be set back. Anthony Randolph did not expect to survive long after he tested positive for HIV.
The first thing I thought was, I'm going to die. How am I going to let my family know about this? You know, it was one of the hardest things I ever had to do. And to realize it myself that I'm HIV positive.
But that life-changing diagnosis was given to him by his doctor 20 years ago. Randolph is now one of more than 1 million people in the U.S. living with HIV.
She said, do you want to live? I'm like, yeah. She said, take this medication every day and you'll live. And I took that to heart. And I take my medication every day because I want to live.
That medication is one of the many life-saving resources Randolph receives here at Harlem United, a community health center on the front lines of the HIV epidemic. Still, despite major advances in the fight against the virus, many worry progress is being undone due to sweeping cuts by the Trump administration. Those cuts included federal divisions responsible for tackling HIV, whether through research or expanding access to medication.
HIV is a chronic disease that can be prevented.
Dr. Yuri Para is the medical director of Harlem United, one of the many organizations that sees firsthand the impact of HIV prevention.
It is really concerning that in 2025, after having come such a long way in HIV prevention and treatment, that we could be risking all the advancements that we have done.
Advancements President Donald Trump championed in his first term when he boldly promised to eliminate HIV in the U.S. by 2030.
To make the needed commitment to eliminate the HIV epidemic in the United States within 10 years. We have made incredible strides, incredible.
What would it take to eliminate HIV?
It means to continue to allow for funding that gets into the community.
For Randolph, that funding is a matter of life or death.
So I asked the people in power, the politicians and stuff, how much is my life worth? How much is our life worth that you're going to make these cuts that's going to affect us so badly that people are going to die?
While Randolph didn't expect to live this long with HIV, he now hopes to live even longer.
It looks like I'm going to make it for the next 20 years.
As long as progress in HIV treatment and prevention continue.
There's a lot more progress to go, and we need to get there. Why stop now? Why not wait until there's a cure?
These changes come as HHS Secretary Robert F. Kennedy Jr. makes good on his promise to transform federal health care agencies. They also come as part of a broader restructuring plan to make America healthy again. Katia Tubman, Scripps News Group, New York.